Next, we have Kevin Kavanagh from Health Watch USA. Welcome, Kevin.
Well, thank you very much. As the committee is aware, the CDC has reported an increase in antibiotic-resistant infections during the COVID-19 pandemic, including Candida auris, group A and B Streptococcus, Salmonella, ESBL-resistant bacteriales. There is even more of a concerning increase in resistance in hospital onset infections, and these include Candida auris, CRE, ESBL-resistant bacteriales, Vancomycin Resistant Enterococcus, drug-resistant Pseudomonas and MRSA. There is concerning evidence that this rise in resistance will be compounded by a lasting immune dysfunction produced by COVID-19. The recent surges in hospitalizations from the respiratory syncytial virus in the United States exemplifies this problem. Not widely reported by the lay press, the United States, Germany, and Sweden had large RSV surges not only this year, but also last year, shedding significant doubt on the immune debt hypothesis. Sweden also had very little masking and few closures during the pandemic. Immune dysfunction from COVID-19 is also supported by clinical studies and abundant laboratory evidence. A non-peer-reviewed study observed almost 100% increase in risk of RSV infections in COVID-19 patients compared to controls. 9.7% of children who did not develop an RSV infection had a documented COVID-19 infection. This contrasts to 19.2% of children who developed an RSV infection and had a documented COVID-19 infection. Another study found a 34% increase in risk of streptococcal tonsillitis in COVID-19 patients compared to controls. The best policy is to prevent patient exposure to drug-resistant pathogens. Screening and surveillance must become a leading strategy upon which others are added. In the case of hospital onset MRSA infections, private sector healthcare in the United States experienced a 17% increase above their 210 to 211 baseline, as the Veterans Health Administration, with a uniform strategy of surveillance and contact precautions, experienced and maintained over an 80% decrease. We need to remember that no matter how high risk a patient is, one will only become infected to a drug-resistant pathogen if one is exposed to it. Thank you.